just a guess, I spend about 80% of my time flat on my back like I am. I have to have my legs elevated. I'm currently taking 5 drugs I take daily, of which I had to forego for this interview, where I'd probably be sleeping. 4 of those are narcotic drugs. They're heavy hitters. These 2 bags down here of empty bottles is roughly what I've taken in the last year alone.
In the hospital emergency room, people show up, more people show up there. We know in the last few years, because they don't have access to health care, they're showing up sicker, with more advanced health problems. And, that costs everybody money. And, just in terms of health care, for example, if you're an insured person and you go to the emergency room and you expect, to be seen fairly quickly, you may be shocked when you go there and find that the emergency room is actually crowded with a lot of people who should have had access to primary care but didn't, and that's why they show up in the emergency room. So it affects all of us.
Well, really, you find where there's high levels of poverty, every possible social problem that exists you'll find, such as again, high crime rates because people don't have jobs, they don't have a sense of future. You find low educational achievement rates. Other ramifications would be lack of health care, so you may have a population of people who are not as healthy, who are really suffering physically. And then also some mental health outcomes that may be poor, such as depression, because there is certainly a link between poverty and depression and people feeling like there's a sense of hopelessness in their lives.
Currently, we're the largest emergency food program in Champaign County. Our original vision was to do the food, and that, like I said, has grown so much so that we average about 150 families every Wednesday that we provide food to. And the clothing, the same thing. We average 1,500 to 2,000 articles of clothing in a 4-hour time frame every time we're open. So a lot of clothing, and then a lot of furniture and appliances and things like that going out the door as well. Basically, we take anything that someone can use that's in good usable shape, we will take and then give away. All of our services are free. We're funded solely through donations from churches, businesses, individuals.
So if people have anything to donate, they can just...
Yeah, we actually have 2 collection bins on the west side of the building that are open 24/7 that you can leave clothing, small items in. And then on Thursdays from 10 to 4, people can drop off larger items, furniture, appliances, things like that.
Although on the one hand, Champaign has some of the lowest unemployment rates, unfortunately the economic opportunities are really not available for families that don't, or individuals that don't have a college degree. So you really kind of almost have a caste system, I would say, here in Champaign that's quite interesting. You have a group of well-educated professionals, and then you have another group of individuals who maybe did not have the same educational opportunities and therefore are relegated to very low income wages, particularly in some of the fast food, service, and retail industries. And they really are not receiving a living wage to be able to work and adequately support their families. You'll find that many of the families who are working the minimum wage jobs, number one, they don't have benefits such as medical benefits, dental insurance, and they usually end up working 2 or 3 jobs, really just to make ends meet.
There are lots of programs out there, and I don't think that we can expect the government, whether it be local or national, to solve all the problems. It really takes the people to do it. And I think as a community, Champaign County does quite a bit. Champaign-Urbana does quite a bit.
We're going to have to redefine what community is, A lot of times we start talking about community, Champaign community, we start thinking about business, we start thinking about the well-to-do community, we start thinking about our beautiful recreational facilities and those kind of things. And what we don't think and we don't mention is the poor.
Sometimes we like to live in that false sense of security and we don't educate ourselves. I think that there's a certain amount of personal responsibility that comes with seeking out the need. Anyone who wants to pretend that there's no need out there are only trying to fool themselves. But I also think that it is up to the people who are working with it every day to just shout it from the rooftops, to have forums like this one, to do whatever they can to educate everyone they come in contact with about the need and how real it is. We have close to 30,000 people who are at or below the poverty level. That we, our average hourly wage is $4 less an hour than the cost of living.
Basically what we do in our community, and it may not go over very well, is that what we do is that we provide all kinds of fundings and resources to draw people to our community that we believe is going to be a benefit to the community. And whatever we've got left over, that usually ends up going to the poor. And what happens is it's never enough, and it's never sometimes not enough money to provide the real necessary services. So what we do is we kind of provide a welfare mentality. We kind of hold people on and continue, and sometimes for years and years they're still receiving resources, and what they really are finances, revenues, and what they really need is to be taught, to train, given skills, and then teach them how to move from one level of life to another level. How do you move from homelessness to home ownership? That's a process, and to be able to provide services that's going to allow a person to be able to do that.
Poverty is violence. When people go hungry, or they continue to be ill when they should have the health care that they need, or they are cold, or they are homeless, when they are stressed every single day, every single week, every single month about how they're going to make ends meet, that is violence. And it's time that we put a stop to this violence, and we are in a position to do it. It's simply a matter of refocusing priorities and developing the will among our elected officials, our leaders, who prioritize funding and policy and where they want to direct the policy. To me, I don't want to live in a community that has beautiful buildings but people suffering all over the place. I'd rather live in a community where everybody has a home and their basic human needs met, and then we can grow from there.
Judge not, lest you be judged, as it says in the Bible, and I've tried to be that way. You don't want to be judgmental on people. You don't know their situation. Some have got through life just by pure luck, hard work for some of them. Well, I used to be a hard worker too. I never expected to be here, and I'm here now, and I want people to listen and watch and see what happens.
I do believe that I am my brother and my sister's keeper. We just need others to believe that and make them allocate. They're the shepherds of the resources of our community. They need to start seeing people living in poverty as their own brother and own sister, and community members deserving of the resources that this community has to offer.
Brother, brother, help me if you can. I don't know where I am, the light's fading. A cry in the night, the voices aching from all the effort that it's taking. He calls out my name, I listen to what I can, and those whispers leave me shaking. Brother, brother,